Welcome in, everyone. We'll get started in a few minutes here. Give it a couple minutes for a few more people to join us, and then we'll get started. All righty. Welcome, everyone. Hello, good morning. Welcome to the applicant info webinar for the Caregiver Support Services request for proposal from the Department of Family and Support Services. My name is Tavia. I'm one of your hosts today. We'll go ahead and get started. So before that, a few housekeeping things. Just due to the volume of the participants, everybody will be muted throughout this entire process, but we'll give you a chance to ask questions throughout to the Q&A. So if you can filter any concerns through there, and we'll likely stop at the midpoint and the end to answer those questions. Just for your awareness, the webinar will be recorded and posted to the DFSS YouTube and website, hopefully no later than 48 hours after this. And the agenda for today, we'll get started with introductions, the purpose of this RFP, the background. Um, we'll give a little information about the scope and program description, and then go through the selection criteria, the timeline, and then I'll come back on for technical assistance and getting through our e-procurement system, iSupplier. And then again, we'll open it back up for questions at the end of the presentation. So with that, my name is Tavia David. I'm the Executive Administrative Assistant for the Office of the First Deputy here at DFSS. And I will hand it over to Karen, and we'll go ahead and introduce the programmatic team.
Good morning, everyone. My name is Karen Cobb. Thank you so much for joining us today. We're really excited about the launch of this new RFP and excited to share with you some of the changes that we see happening to the program. I am here, I'm manager of senior services. I am here in lieu of my caregivers, my colleague Stacy Subida, who is the supervisor of family and sports services and oversees our caregiver portfolio amongst other programs. I'm also very pleased to introduce Veronica Whitby Cozy, who is a community living specialist and oversees directly the programs, the delegate agencies who work with our caregiver programs. And so she's here as well. Veronica and I will be presenting this RFP to you today. But before we go ahead and do that, I wanted to go ahead and introduce our Deputy Commissioner of Senior Services and Executive Director of our Area Agency on Aging, Margaret LaRaviere. Margaret, thanks for joining us.
Thank you. And I'd like to say good morning to everyone. I thank Karen, Veronica, and Stacy for the work that they have put into the release of this RFP and the support provided by Tavia. We are so very excited about the release of this RFP as we seek to continue to provide caregiver services across this great city of ours. So thank you all for attending, and we encourage everyone to apply. Thank you, Karen.
Thank you, Margaret. So let's go ahead and get started. You've seen what our agenda is for today. We have about 2 hours allotted. I don't know that we'll take that entire time, but please recall, as Tavia said, this is being recorded. And so we will be able to ask questions. Tavia, I'm going to ask, is the chat enabled? Tavia, I'm not sure if you can hear me.
The chat's been disabled for this time, so if at this point we're going to filter everything through the Q&A.
Okay.
But I'll open the chat back up at the midpoint and also at the end.
Okay, so keep those questions. And let's see, for some reason, let me just trying to go backwards to the first slide about DFSS. Here, I see it right here. Thank you. Okay. Excellent. So we are the Department of Family and Sports Services, and we are a lifespan department. And our mission is to work with community partners like yourselves. And we connect Chicago residents and families with resources to build their stability, to support their well-being, and empower them to thrive. You can see that our priorities below on the screen. We deliver and support high quality, innovative, and comprehensive services. We collaborate with our community partners, sister agencies, and public officials on programs and policies that helps those Chicagoans' lives. We want to inform people of resources available to them through DFSS and our community partners. And of course, and certainly, steward DFSS's resources responsibly and effectively. As I said, we are a lifespan organization and growing. Our department starts with children's services, which you may be familiar with, Head Start and Early Head Start. We go to youth services, which of course the Hallmark program is One Summer Chicago and other programs to engage youth. pardon me. We have our homeless services program, which focuses on individuals impacting those who are at risk of losing their housing, so those with housing insecurity and those who are actively without a place to live. And this also is including right now our new arrivals who have come. I believe we're at over 20,000 since last year, and so that is also included in homeless services. We have our division on domestic and gender-based violence, which previously was just the division on gender-based violence. And what we do there is we have our DV hotline and legal counseling and advocacy, amongst a range of other services. We have our human services program, which serves individuals 18 and older throughout 59, and they also support some older adults in the community. We have our 6 community service centers across the city of Chicago, where services like case management, referrals, and public benefits assistance are provided, amongst others. We have our workforce services division, which works with those in need of job placement and assistance getting a job. Of course, in continuing to support those returning residents who are coming back to the community and are experiencing re-entry. And then finally, our senior services division, which you'll see highlighted in yellow. We have a range of services and supports to help Chicagoans age well in their community and to provide them access to the resources to which they are eligible and entitled. So we're also the local area agency on aging for the city of Chicago. We are one of 13 within the state of Illinois. And as the area agency on aging, we coordinate and fund services for older adults, prioritizing those in the greatest economic and social need, those who live alone, and those who are at risk of institutional placement. And we do serve all older Chicagoans age 60 and better. And we work in collaboration with our aging network partners, and our divisional efforts are guided by supporting older people to live independently in their own communities and homes for as long as possible, ensuring that those who reside in institutions are treated with dignity and care, and guaranteeing that older adults have access to accurate information and can actively participate in public policy. Together with our service providers and delegate agencies, we provide vital information and assistance, congregate and home delivered meal services, our 21 senior centers throughout the city of Chicago, fitness classes, caregiver supports, in-home services, employment training and volunteer opportunities, elder rights programs, including adult protective services and the ombudsman program, health promotion, and access to benefits. We are continually innovating and advocating for older Chicagoans so they can continue to thrive as they age in place. We value integrity and respect, as well as promoting social engagement amongst older adults as an antidote to dependent social isolation and withdrawal. I encourage you all to see our new strategic framework posted on the address below. Additionally, we wanted to highlight the city of Chicago's definition of equity. And as an outcome, equity results in fair and just access to opportunity and resources that provide everyone the ability to thrive. As a process, equity requires a new way of doing business, one that prioritizes access and opportunities for groups who have the greatest need. It methodically evaluates benefits and burdens produced by seemingly neutral systems and practices, and engages those most impacted by the problems we seek to address as experts in their own experiences, strategists in co-creating solutions, and evaluators of success. We view equity as the fair, just distribution of resources, explicitly targeting and prioritizing groups who have the greatest need due to being systemically disenfranchised, particularly based on historic patterns of racial and economic exclusion, and using these resources to address present, past, and future injustices and their consequential burdens. to get to this RFP, which, as I said earlier, we're very excited about. DFSS Senior Services seeks proposals from community organizations who have experience providing assessments, counseling, support groups, memory cafes, memory and caregiver kits associated with those cafes, training and education, and gap filling for caregivers of any age who provide informal care to an older adult age 60 and older, or to an individual with Alzheimer's disease or related dementia. Respondents may include, but are not limited to, for-profit and nonprofit organizations, universities, hospitals, healthcare providers, faith-based organizations, and/or organizations that support older adults and their caregivers. We seek to provide caregiver support services through up to 3 regional delegate agencies in the north, west, and south sides of the city. You can see a map here which shows the regional areas. We have the north area, the west area, and the south area of the city. Now, this is funded through Title IIIe of the Older Americans Act through the Federal and Alzheimer's Disease and Related Dementia, ADRD. DFSS received additional state funding in FY23 to support caregiver services, which we have directed toward this grant. So in FY23, we funded 1 delegate agency to provide citywide services at $253,300,000. This DFSS Caregiver Counseling and Support Services RFP will provide funds for up to 3 delegates to meet the needs of caregivers in the city of Chicago. We seek those delegate agencies with the capacity to increase the number of caregivers participating in caregiver support services programs and to ensure that caregivers' needs are being met. Now, the goals of this RFP are to help caregivers of any age access services, support, and assistance with managing and navigating the challenges of caring for a loved one age 60 and better, or an individual 18 to 59 with Alzheimer's disease or related dementia. And we do that through assessments, training and education, counseling, support groups, specialized memory cafes, memory loss support groups, gap filling, and memory and caregiver kits. Our goals are as follows: to alleviate caregiver stress and social isolation, to empower caregivers to solve or cope with programs caring for the care recipient, to improve the caregiver's health and wellness, to increase awareness about the essential value of caregiving and caregiver support services, to increase the caregiver's confidence to continue to provide person-centered care for the care recipient, to identify resources and social services to support the caregiver and care recipient, with the end goal of delaying premature institutionalization of the care recipient. So the current state and our priorities for improvement. According to AARP, an estimated 38 million people, or about 11.5% of the population, are caregivers. IDOA estimates, the Illinois Department on Aging estimates that there are over 400,000 caregivers in Chicago, approximately 70,000 of which fall between the ages of 60 and 74, and 20,000 who are older in the age range of 75 to 84. We know very clearly that for caregivers, there's a potential loss of wages and employment, along with additional expenses and responsibilities, which can lead to stress and burnout, negatively impacting the caregiver's health and ability to care for their loved ones. In Illinois, 75% of current and family caregivers say that it's extremely or very important to have more resources for family caregivers. Programs have been required by national and state plans, including TCARE, which is a caregiver assessment tool, Savvy Caregiver, and stress busting for family caregivers. Moving on, our target population. So caregiver means an adult family member or another individual of any age providing informal home in-home and community care to an older adult age 60 and better, or a care recipient with Alzheimer's disease or related dementia under 60. A care recipient may be considered an individual 60 years of age or older, or a person with dementia, and may include an individual with undiagnosed memory loss, those diagnosed with mild cognitive impairment or MCI, Alzheimer's disease, Parkinson's dementia, vascular dementia, frontotemporal or FTP dementia, primary progressive aphasia, or other related conditions. Caregivers must be prioritized based on Older Americans Act Title III guidelines, which include states' preference for those with the greatest economic or social need. Older adults funding dictates that respondents pay particular attention to serving caregivers in low-income minority communities, as well as those that are traditionally underserved that have limited English proficiency. And services are required throughout the city. I will now hand over this to my colleague, Veronica, who will take us down some of the program requirements. Thank you, Veronica.
Thank you, Karen. So we're going to lead into our program requirements, beginning with outreach. So the respondent must conduct ongoing outreach activities to ensure participation and retention in the program. Outreach efforts may include, but are not limited to, community presentations, brochures, flyers, and/or social media. Program promotion through the various news and public information media is subject to approval by the DFSS Public Information Officer and must credit DFSS and/or funder as the source of funds supporting the Caregiver Support Services Program. The annual budget for the outreach, including the purchase of promotional materials, is $20,000 per region or $60,000 total. And next slide. Intake. DFSS INA is the lead contact to receive intake calls and refer caregivers to the selected respondent. The selected respondent at minimum must be available to accept referrals during DFSS working hours, 9 a.m. to 5 p.m., Monday through Friday. The selected respondents are responsible for contacting the caregiver within 72 hours of receipt of the referral, and this is to determine the level of services. The selected respondent may take direct referrals. However, a record of the direct referral should be forwarded to DFSS so INA can assess participants' needs for other services. Service categories. There are 7 required service categories available through the Caregiver Support Services Program. They are the following: T-Care assessments, individual and family counseling, support groups, training and education, memory cafes, memory caregiver kits, and gap filling. And caregivers may attend more than one program in more than one category. So our tailored caregiver assessment and referral, which is our T-Care assessment, DFSS will require the respondents to utilize the T-Care assessment tool and create a care plan on every caregiver participating in the caregiver support services. Assessment should be completed in person. Virtual options should be made available, telephone or web-based tools such as Microsoft Teams, Skype, Zoom. They can be provided as an alternative in extenuating circumstances. Now, the unit of service measurement is one in-person full assessment. The unit includes the time spent in direct interaction with a caregiver and should include travel, paperwork, planning, and administrative duties. Once the T-Care assessment has been completed, the provider will enter the caregiver information into Aging IS. Each client will be fully assessed once during a fiscal year or more frequently based on the client's need. Selected respondent are also required to conduct quarterly follow-up calls, which this could warrant another full assessment if the client has had a significant change. The target for T-Care assessment is 200 unduplicated caregivers per region, or 600 total unduplicated caregivers, and this is citywide per year. The annual budget for assessment is $11,416 per region, or a total of $34,248. Individual and family counseling. So counseling is a short-term, direct interaction between a licensed mental health professional and an informal caregiver. The interaction can be in person or virtual. Options are telephone or web-based. If in person is not available, virtual options must be offered. So counseling is provided to caregivers to assist them in areas of emotional support, health, nutrition, financial literacy, and making decisions and solving problems related to their caregiver roles. Their unit cost rates, the unit of service is 1, and that's for a 1-hour session per participant with a cap of 6 sessions. The unit includes time spent in direct interaction with the caregiver and should include travel, paperwork, planning, and administrative duties. The target for the individual family counseling is 33 unduplicated caregivers per region, or 100 total unduplicated caregivers for the year. The annual budget for counseling is $17,500 per region, or $52,500 total. So our support groups. So the purpose of the support groups is to provide a safe environment where caregivers can support their peers by exchanging thoughts, ideas, concerns, and coping strategies. The selected respondent, they're responsible for managing the support group. This includes training and supervised paid volunteer, in-kind, or a combination of support group leaders. The group leader should coordinate, schedule, and facilitate the support groups in their local areas, including outreach to recruit participants, schedule guest speakers, and distribute information the selected respondents to support. The selected respondent must offer in-person and virtual support group sessions throughout the city. If in-person is not accessible to the caregiver, virtual options must be offered. Unit cost rates, the unit of service is 1 session per participant per group. The unit includes the time spent, direction with the caregiver, and it also, of course, should include travel, paperwork, planning, and the administrative duties. The selected respondent are also responsible for tracking member participation and contact information to be submitted to DFSS as requested. The target for support groups is 20 per region, or total 60 unduplicated caregivers per year. The annual budget for support groups is $10,000 per region, or $30,000 total.
All right.
And I'm going to switch this back over to you, Karen.
Thank you. Thank you, Veronica. So I'm going to talk a little bit more about program requirements, and some of these are new. And so we are seeking to introduce memory cafes into our regional caregiver services. And memory cafes are monthly social group gatherings where both caregivers and care recipients who are experiencing memory loss jointly attend to participate in activities and positive social interactions with peers in a safe, supportive, and engaging environment. They're intended to be a social program for both the individual with memory loss and the caregiver together. It's not intended to be something like a drop-off or a respite program. Rather, it's to offer a space for caregivers and the care recipients to have peer support. They are typically facilitated by a volunteer or a professional who can help to coordinate discussion and activities. And they can be held at a wide range of locations, including but not limited to our 21 senior centers throughout the city, libraries, community centers, restaurants, or houses of worship. Selected delegate agencies can use funding to create a new memory cafe opportunities within their identified service region, and can also use that funding to help expand, strengthen, or support program activities at existing memory cafes. So what are the program requirements of a memory cafe? The programming should be comprised of interactive activities that may include, but are not limited to, sing-alongs, musical instruments, art therapies, crafts, massage therapy, events, storytelling, poetry, pet therapy, tai chi, chair yoga, aromatherapy, and virtual travel logs and games. DFSS expects a minimum monthly programming for up to 2 hours per session be offered. Each cafe has the flexibility as to the day of the week and the time of the day that the session will occur. Our target for this component is to serve at least 30 unduplicated individuals. And so that's a dyad of the caregivers and the people with dementia per memory cafe. So 60 unduplicated clients per region, or 180 total participants per fiscal year citywide. Both caregivers and care recipients will continue to be counted as participants individually. Multiple caregivers are permitted to attend. So that might be an adult daughter might bring a loved one one day, a spouse or partner may bring them another day. Each region will be expected to operate 2 memory cafe sites. The funding in this area can be used for rental space, food or refreshments, staffing, entertainment, speakers, instructors, or supplies. We do have some things that are not allowable. This includes cash assistance, gift cards, travel expenses, mortgage or rental assistance, co-payments or deductibles towards items covered under programs or public benefits, and legal fees. Our unit costs and rate. The unit of service is 1 session per participant. Caregivers and care recipients each receive 1 unit of service for each session attended. Each memory cafe will be expected to conduct at least 1 monthly session, and it's recommended that the session be in general 2 hours. Administrative activities, so setup, transportation, paperwork, those would be completed outside of the 2-hour session. So the annual budget for memory cafes is $38,266 per memory cafe, or $599 total. Let me repeat that. $229,599 total. So we also have memory and caregiver kits. And it's our expectation that each respondent will distribute memory and caregiver kits to support caregivers and care recipients experiencing dementia with activities and sensory needs. The memory kits should be targeted towards individuals in the middle or moderate stages of dementia. They can include, but are not limited to, cards, puzzles, fabric, feathers, and instruments. The caregiver kits should be directed towards the caregiver or the person providing care to the person with dementia, and can include things such as journals, pens, hand sanitizer, hand lotion, and more. In instances where items fall outside the allowable purchase, it will require written approval of the DFSS program manager and/or funding availability. Now, the units, costs, and rates. 1 unit of service is 1 kit per caregiver or care recipient. This includes identification of resources, purchasing an item or coordinating the purchase, coordinating the delivery of items, and verifiable documentation of expenses. Delegate agencies are encouraged to utilize tax exemption to purchase items if and when applicable. The target for distribution of memory and caregiver kits is 50 caregivers and 50 care recipients for a total of 100 per region, or 300 unduplicated caregivers or care recipients citywide per year. The annual budget for those kits is $10,000 per region, or $30,000 total. Training and education, and this is something that we have been doing. So this is a continuity of the existing services. And caregiver training and education offers educational opportunities for caregivers to increase their knowledge, skills, and abilities to cope with caring for a loved one. These sessions can be held in a variety of ways: webinar, in-person lectures, classes, workshops, evidence-based programming, or conferences. Such sessions are usually a useful way to conduct outreach, as well as promoting the selected respondents' more intensive caregiver support programs. The target for training and education services is 33 per region, or 100 duplicated caregivers citywide. It's really 99. Topics can include, but are not limited to, personal care training, health and wellness education, technology assistance, financial planning, advocacy and legal issues, long-term care supports and services. Again, it can include that, but is not limited to it. The selected respondents will be trained and required to administer in-person stress busting for family and caregivers program. And a unit of service is the number of participants per one session. The unit includes time spent in direct interaction with the caregivers and should include travel, paperwork, planning, and other administrative duties. The annual budget for education and training is $15,950 per region, for a total of $47,850. Gap filling. Again, gap filling is currently offered. This is continuity of the existing services. And gap filling services can be provided to purchase a limited supply of goods or services that complement the care provided by caregivers when all other resources for goods and services have been exhausted. The selected respondent would adhere to the approval process and document how the money was used. Purchases must be made in accordance with allowable purchases set by DFSS and within IDOA's services allowable under the Older Americans Act. And gap filling can provide up to $500 of appropriate goods and services each fiscal year per care recipient. Selected respondents can utilize a combination of direct paid staff, subcontractors, in-kind, and volunteers to fulfill gap filling services. The target for gap filling services is 70 unduplicated caregivers per region, or 210 unduplicated caregivers citywide. So let's go a little bit more into gap filling. So they include support items for the care receiver or the caregiver. So it can include medical supplies and equipment not covered by Medicare, Medicaid, or other insurance. So for example, if a shower bench was used, you would exhaust other funding sources prior to going to gap filling. Requests for medical supplies should receive physician verification where possible, and requests for prescription medication must receive physician verification as well. This can also include adaptive clothing, furniture, glasses, and other aids, adaptive safety devices such as emergency home response and assistive technologies, emergency transportation, and nutrition, which may include food boxes or groceries. There are some things that are not allowed under gap filling. That would include cash assistance or gift cards, travel expenses, mortgage or rental assistance, automobile payments, sporting or recreational assistance, copays or deductibles towards items covered under other programs or public benefits, and legal fees. So in order to be eligible for gap filling services, family caregivers must be providing in-home and community care to older adults who meet the following definition of frail as outlined by the Older Americans Act. Frail means that the older adult is determined to be functionally impaired because the individual is unable to perform at least 2 activities of daily living without substantial human assistance, including verbal cues, physical cueing, or supervision, or due to a cognitive or other mental impairment. Thus, they require substantial supervision because the individual behaves in a manner that poses a serious health or safety hazard to the individual or another individual. As far as the unit costs and rates, 1 unit of service is equal to 1 incident of gap-filling assistance. This includes assessment of needs, identification of resources, purchasing of an item or coordinating purchase, coordinating the delivery of the item, and verifiable documentation of expenses. Delegate agencies are encouraged to utilize tax-exempt status to purchase items when applicable. Our gap-filling budget is $31,666 per region, or $95,000 total. How does the reimbursement process work? Well, the selected respondents are responsible for paying the cost of gap filling services and invoicing DFSS. So DFSS then reimburses the exact cost of the item and service purchased by the care recipient. Fiscal procedures to account for every expenditure and receipt of supplemental gap filling services are required. The selected respondent must document expenditures and follow up to determine if the item or service was delivered or received. In order to meet the demand for commonly purchased gap filling services, the agency needs to have their own vouchering process, and delegate agencies are encouraged to utilize tax exemption to purchase items when applicable. We also require that our respondents have an emergency contingency planning. So special emphasis should be placed on developing contingency plans for any emergencies. So pandemics, winter storms, tornadoes, heat waves, which might require a change in programming, registration, location times, etc. Sometimes it's necessary to transition in-person interventions to other delivery methods if and when local officials deem in-person programs unsafe. The selected respondent should develop policies and procedures to include sections on training, PPE or personal protective equipment, health screenings, temperature checks, as well as contact tracing. Policies and procedures should be created and act in concert with the CDC or Centers for Disease Control, the Illinois Department of Public Health or IDPH, and FEMA, the Federal Emergency Management Guidance. What are the qualifications for staff? The selected respondents are required to assign and maintain for the duration of services a staff of qualified personnel to perform those services. The selected respondent will retain and make available to the city, state, and federal agencies governing funds provided under this agreement proof of certification or expertise, including but not limited to licenses, resumes, and job descriptions. The staff will include management and supervisory staff, clinicians, and support staff to provide quality caregiver support services. Staff may include management and supervisory staff, support staff, and/or volunteers, unless subcontracted to a third-party provider. Funds are expected to cover at least 2 full-time employees in each region, dedicated to the success of the program. It is allowable for employees to have other roles within the organization as appropriate, and as it does not impede their work on dedicated time to the Caregiver Support Services program. The program coordinator or director will be responsible for supervising program staff and volunteers and have overall accountability for the program and service delivery. The position may not be vacant at any time during the contract period. It is preferred that the staff have a master's degree in a social science field, either social work, gerontology, psychology, counseling, psychiatric nursing, or rehabilitative counseling, and at least 2 years related social service counseling and administrative experience. We also anticipate mental health clinicians. The respondent should identify a mental health clinician to administer comprehensive assessments, provide therapeutic counseling, and create plans of care, and identify and educate caregivers about additional resources. It's preferred that the staff have a master's degree in a social science field, social work, gerontology, psychology, counseling, psychiatric nursing, or rehabilitation counseling. This person must be licensed, registered, or certified by the state of Illinois and possess that license, registration, or certification. Moving further into staff qualifications, the respondent shall, at its own cost and expense, comply with all federal, state, and local laws, ordinances, policies, procedures, regulations, rules, requirements, and executive orders relating to background checks, fingerprinting, and screening procedures to ensure the safety of the older adults this program works with. These background checks are an allowable expense if they are included in advance in the budget. The respondent is required to obtain for all staff a criminal background check, which includes electronic fingerprinting and also checks the Adult Protective Services Registry on each employee with direct participant impact. So please see the bullet with the exclusionary list websites listed below. Client contributions. The selected respondent may not charge for any caregiver support services programs provided under this grant. However, pursuant to the Older Americans Act, all clients must be provided the opportunity to contribute or donate to the cost of their services. These donations are strictly voluntary, and no client should be refused for service for not contributing. The selected respondent must collect, record, and report contributions received to DFSS on a monthly basis. All donations must be used to expand services. The amount of contributions collected may be deducted from the monthly invoice submitted to DFSS. Suggested contributions may range from $2 to $15 per service unit. The respondents are encouraged to collect project income, client contributions, to defray program costs where appropriate. Okay, performance goals and outcomes. To monitor and recognize immediate progress towards the above performance indicators, DFSS also intends to track output metrics that may include, but are not limited to, and will be modified to match the selected RFP application. So that includes, per region, 200 T-Care assessments for a total of 600 citywide, be conducted annually. 100 participants, or 33 per region, and 300 units of counseling services will be provided annually. 60 participants, or 20 per region, and 230 units of support groups will be provided annually. 100 participants, or 30 per region, and 345 units of training and education services will be provided annually. 30 participants per memory cafe site. That's 60 per region, so it's 30 dyads, or 180 participants. And 1,080 units of memory cafe services will be provided citywide annually. 300 participants, or 100 per region, and 300 units of caregiver or memory kits will be provided annually. 210 clients, or 70 per region, and 210 units of gap filling services will be provided annually. Let's look deeper into those performance goals and outcomes, and this is for January through September 24, which is year one. So T-Care assessments, you can see 150 clients per region and 150 units per region, and you'll see citywide totals to the right. Counseling, 30 clients per region, and 87 units, for a total of 88 units clients citywide, and 263 units. Support groups regionally are expected to be 15 clients per region and 57 units per region, going out to 45 clients citywide and 173 units citywide. Memory Cafe impact is expected to be 60 clients per region for 360 units per region, or 180 clients citywide and 1,080 total units citywide. Memory Caregiver kits, 100 clients per region, 100 units per region, with a corresponding 300 clients and 300 units citywide. Training and education, 30 clients per region and 102 units per region, or 88 clients citywide and 308 total units citywide. And gap filling at 58 clients per region, or 79 units, and 176 citywide and 239 units citywide. To track progress towards achieving the outcome goals of this program and assess success, DFSS will monitor a set of performance indicators that will include, but is not limited to, 80% of caregivers who participate in the Caregiver Support Services RFP feel a reduction in stress levels. 80% of caregivers have learned one or more new strategies or techniques to cope with caregiving issues or problems. 80% of caregivers self-report improved health knowledge or improved health indicators from before the intervention as applicable. 80% of caregivers feel an increase in their confidence and continue to provide care for the care recipient. And 80% of caregivers feel more aware of the caregiver supports available to them. Community involvement. DFSS will evaluate applications based on the following criteria. The respondent demonstrates a clear understanding of the target population and is familiar with the challenges they face. The respondent is committed to providing client-centered services through meaningful community engagement opportunities. The respondent provides culturally competent, inclusive, and accessible services. The respondent is working to become more inclusive in terms of staffing and internal operations. And the respondent values and reflects diversity and inclusion in their leadership. Moving on to organizational capacity, we will evaluate applications based on the following criteria. If there are appropriate personnel to deliver the program as proposed, that the respondent has dedicated an adequate percentage of staff time towards the caregiver support program. The respondent has the capability to serve people with dementia and their caregivers and make services accessible. The respondent provides ongoing training opportunities for their staff. The respondent has adequate fiscal monitoring and controls and has a human resources policy and procedure, has the capacity to hire and manage staff in a timely manner. We will also evaluate the strength of the proposed program based on the following criteria. The respondent clearly defines services to be provided that are appropriate to address the needs of and achieving desired outcomes for the target population citywide via the proposed program model. That the proposed program model is supported by a strong national or local evidence base and or aligns with best practices for the relevant field. The respondent has an effective approach to addressing gap filling services, including a plan for identifying caregivers, assessment, approval, identification, coordination, and delivery of gap filling activities. The respondent has a plan to serve caregivers in the target populations in the region specified. The respondent has an effective approach to identify, recruit, and retain caregivers. The respondent proposes why they are best equipped to service their proposed region. The respondent describes the frequency of programming, the types, be it in-person, virtual, and/or hybrid, and rationale for those types and frequencies. The respondent includes a contingency plan for any emergencies. The respondent proposes a plan for the memory and caregiver kit component. And finally, that the respondent works with other service providers to ensure that client needs are met. The respondent provides specific partnerships and details the nature of their relationship to other providers. We will also evaluate applications for performance management and outcomes, and will evaluate based on the following criteria: that the respondent demonstrates evidence of strong past performance against desired outcome goals and performance metrics and/or other notable accomplishments in providing services to the target population. The respondent has relevant systems and processes needed to track and report performance on program outcomes. The respondent has experience using data to inform or improve its services and practices. The respondent has relevant systems and processes needed to collect and store key participant and performance data. And the respondent includes performance improvement strategies or frameworks. Also sought in the applications is, of course, information on reasonable cost, a budget justification, and how you will leverage funds. So to that end, we will evaluate applications based on the following criteria. The respondent describes its auditing practices and if the award will be included. The respondent has the fiscal capacity to implement the proposed program. The respondent leverages other funds and in-kind contributions to support total program and administrative cost. So that's, for example, state, federal, foundation, corporate, and/or individual donations. The respondent demonstrates reasonable implementation costs and funding requests relative to its financial and human resources. The proposed budget should support the proposed scope of work and/or work plan. The respondent includes key budgeting decisions. You may also include attachments in your application, and we would encourage you to attach reports, studies, or other documentation that show performance towards reaching the program goals and demonstrate key results and accomplishments. We ask that you attach the resumes and/or job descriptions for key staff that would oversee the programs, and also ask that you attach your organization's budget for this program. Please make sure all program requirements are addressed. The evaluation process. Proposals are evaluated on the strength and the responsiveness to the selection criteria. Failure to submit a complete proposal or to fully respond to all requirements may make your submission subject to rejection. The commissioner, upon review of the recommended agency, may reject, deny, or recommend agencies that have applied for grants based on previous performance and/or area need. DFSS reserves the right to ensure that all mandated services are available citywide and proposed in a linguistically and culturally appropriate manner. Okay, so this is our timeline. I want to make sure to highlight that. Before I do so, I would like to draw attention to a question that came in on the Q&A. And the question was, do all categories need to be offered in the proposal? Or can a proposal offer, say, 4 of the 7? All 7 services should be offered in every region. So we ask that your proposal include a plan for each of the 7 service areas that we have indicated. Let's go back to the selection and transition timeline. Today, December 4th, is the pre-proposal webinar. This is recorded and will be available to review. The due date to submit pre-proposal questions is December 20th, 2023. Applications are due December 27th, 2023. And the program period will begin January 1st, 2024. The costs or budget proposals. The term of the contract executed under this RFP is from January 1st, 2024 to September 30th, 2025. Based on need, availability of funds, and contractor performance, DFSS may extend this term for up to 1 additional year, with an extension not to include 1 year. The amount of this RFP for 1 year is $193,065 per region, for up to $500,079, $197 total per year, depending upon the size of the proposed program. This contract will operate on a reimbursement basis only. Please submit a budget for 1 year or 12 months of services. The cost category definitions are attached as budget instructions in every RFP, except RFPs that have cost proposals. Please be thoughtful and inclusive when you develop your budget. Apply for your program's actual costs. We generally cannot give you more money than what you ask. Use the reasonable cost question on the application to discuss how you determine the costs that are reflected in your budget. There are some common errors, and so we ask you to pay special attention to these. Check your fringes calculations. On supplies, these are frequently under or over budgeted for. Client assistance, if this is an appropriate and allowable cost, don't forget to include it. Make sure your job description titles and your job description uploads have the same title. Also put a brief description of the job in the budget document itself, if you have not discussed it specifically on your application. Put your budget in the appropriate column, and please make sure to show your match. All right, another prompt here. Applications are due Wednesday, December 27th, 2023, and they're not due at 5 o'clock. They're due at noon. So please pay attention to that. Again, that's Wednesday, December 27th at 12 p.m. noon Central Time. Thank you. I'll turn it over to Tavia.
Thank you, Karen.
Sure.
Before you switch out of programmatic things, it looks like there was another question in the Q&A, another couple questions in case you want to answer those live
Let's
here.
see. Can the agency propose a model where we would work in collaboration with other providers as subcontractors, performing most of these categories of services? So Veronica has replied, the selected respondent will be responsible for program management, including outreach, assessment, program implementation, retention, and data collection on the impact of the program. Individual interventions could be delivered in-house or contracted to a third-party provider or a combination. Models can include paid, volunteer, and/or in-kind professional and laypersons. Don't forget, everyone has to be background checked if they're working directly with the older adults themselves or are handling their information. Overall, the respondent should aim to serve 200 caregivers per region for the full fiscal year for a total of 600 caregivers citywide. Veronica, I see you've come on camera. Would you like to add anything additional to that?
No, I think it speaks for itself. It's just we are validating that subcontracting is available to selected respondents as long as it is falling within these categories.
Thank you, Veronica.
Okay.
Some delegate agencies may opt to use subcontractors and collaborate with other organizations or entities in order to reach hard-to-reach populations, for example.
Great. It looks like lastly, we have a question asking what is the match requirement?
I believe the match is 10%.
Okay.
We will verify that. And don't forget that we will issue a, an addenda. No, that's not what it's called.
Amendment, yeah.
An amendment? That's what we put out, an amendment, right?
Yeah.
Okay,
With
so
all
the amendment will
questions.
go over all of these questions, and then also we'll have any questions that were emailed that will be distributed to everyone on this webinar. So everybody will see access to the questions that are asked and the responses, as well as any clarifying information.
Great. Well, thank you, Veronica, Karen, and Margaret. I'll take it over from here to
Perfect.
discuss getting into the actual system to submit your application.
Great. And we'll go
Um,
ahead and stay on in case you need us or anything like that, of course.
Yeah, that'd be great if you can, and in case there are any questions at the end.
Perfect. Thank you so much for everyone on the call. We are really excited to read your applications.
Yep.
Great. Okay, so with that, again, I want to reiterate the deadline for your review. It's December 27th at noon, as Karen stated. We're going to say that a few more times throughout, um, just so you are aware. But it's really a cautionary tale because we want you to be able to submit an application successfully. And best practice is to start early and save often. And your goal really should be to submit your application a day before, ideally a couple days before, just to give a buffer room for any technical issues. So if you've never done business with the city of Chicago, you want to go ahead and register an iSupplier. I would say now, as soon as we are off of this info session. It's very important, even though it was a lot of concise and rich information in this particular webinar presentation. It's really important for you to go and read the RFP thoroughly. Once you register an iSupplier, it's attached as a PDF for your review, and we always encourage you to read that thoroughly. The great thing about the criteria questions is that you have a 4,000 character limit. Most people don't meet that limit, but just know that it's there in case you have a particularly wordy response. And then the back button is not your friend in the system. I'll say that a few times again throughout. But you always want to navigate forward. So if you have a change or you want to go back to something, you want to save your draft and then click on the criteria that you want to edit again going forward. Multiple proposals are allowed for this particular RFP, but you would need to create a separate email address if you want to submit a different proposal, or if you're collaborating with anyone and want to submit for a different region. You'll need to use a separate email address for each proposal. And there's the due date again on the 27th at noon. And I say this from experience, you want to avoid saving everything to the last minute. I'm available. I'll put my contact information along with Karen and Veronica's at the end, but and Stacy, who's the manager for this RFP. And you can reach out to us ahead of that time if you have any technical issues, but please, if you can, just plan to submit at least a couple days prior, because late applications are not accepted under any circumstances. The application and the request for quote will close right at noon on the 27th, so just be aware of that. Additionally, you have other resources through the procurement hotline, and you can find that number here at 312-744-HELP. If you have any technical issues and we're not readily available, they're always available to help you out. At least from Monday through Friday, 9 to 5. I'm going to reiterate once more, start early, save often. If you're a new agency and you've never done business with us, these are the requirements that we would need in order for a successful contract to be accepted into the system. And that's the articles of incorporation, your IRS affirmation letter, your DUNS number, your CCR, and your certificate of good standing. And if you have any questions about those, we can, again, you can reach out offline and we'll help you out. Technical assistance is available. There are plenty of training documents available for delegates, and you can find that on DFSS's website through the alert section. And if you have any additional questions, you can access these resources here. I've also attached a pretty thorough guide of how to get through iSupplier in the actual quote. So once you log on and register and create a username and go to this particular quote, there's a guide also attached to this RFP. Okay, let's go with how to enter responses and accept amendments. Firstly, you'll create a quote once you've registered, and that is step one here. Once you're in the actual system and you've clicked on the request for quote number, which for this particular RFP will be 9921. And then you'll press go. And if there is an amendment, which again, the questions that we've provided here will be attached as such. Before continuing through the RFP, you'll need to review the amendment and agree that you've read it thoroughly before continuing to submit the application. So with that, it'll prompt you with the screen to accept the amendment prior to submitting any more responses. And that process is just, you will be navigated to this screen here, and then just verify that the RFQ number is the same. And any amendments that are added, you'll see a comma and a number after that, and that's just indicating what version of the amendment is available or is the latest. And you'll be able to click on these glasses on the far right here to see what changes have been implemented. And then once you've read those, you can go ahead and acknowledge amendment and accept it here to advance forward. You'll be prompted again to accept the terms and conditions, acknowledge those terms and conditions, and then it'll give you an indication that you have accepted the amendment successfully. And to advance, you'll just press yes to go to submit your application. I'm going to open up the chat for like a informal discussion in case you guys have any technical questions. But oh, this is another screen indicating that you'll have to accept the terms and conditions. There's quite a few, and it's just really these are in place. These fail-safes are in place just to make sure that you have read it and that you understand, and we get your approval to move forward. Okay, now actually submitting an application is a different process. So you'll want to, when you're ready to submit, you'll start by saving the draft and clicking continue. And saving the draft is another acceptance of the amendment that's available. I know it's a lot of steps, but it's just the way the system is set up. And of course, if you're missing any information or requirements or selection criteria, that error message will pop up in the top left, and it'll tell you what you're missing, and that will need to be added or adjusted prior to advancing forward. Again, this particular example is indicating that the lines are not, there are no values in the lines, and the lines is something that should match your budget. So you'll want to click on this tab here and enter the information that's the same as the budget that you're uploading. And that information will need to be in there prior to advancing forward. Okay, and this particular example, someone left their name off of the quote, and so it's telling you that you need to fill in the value box on the bottom left here before you can continue. Again, any error that comes up, you'll see it in the top left corner, and you'll need to correct that prior to continuing. Once the application is free from errors and you have done or answered all of the requirements, you're ready to proceed. And at this point, you can click continue, and you should put your application into review for submittal. After that point, you'll be navigated to this review screen, and it'll give you a summary of all the questions you've added into the system so far. This is the requirement we've asked for on the left, and on the right is the quote value that you've entered in. Just make sure everything matches and everything is correct, because again, once you've submitted, and especially once you've passed that particular due date, there is no way to change this information. So just be sure to double check that all your information is correct. At this point, you'll be prompted to give an electronic signature to say that all the information is correct and has been added. Yeah, just be sure to check this box, put a name and a title, and then submit on the bottom right. And then you will get a confirmation that your application has been submitted successfully. It should look like this with a green check. I want to reiterate that the back button is not your friend. So what you want to do is just rely on the save draft for any changes that you've made. Even if you made a mistake on a question, you want to just save the draft and then go back into, if you want to go into a different question, always advance forward, because going back would kick you out of the system. Okay, with that, are there any more questions from anyone? I opened up the chat, but feel free. This is the time to get any last programmatic questions out before we send you off to submit a successful application, hopefully. Okay, well, if there are no more questions, like I said, what's been asked today will be compiled in an amendment, and it'll be added to the RFP for you to accept. The program manager for this RFP is Stacy, and Karen was kind enough to fill in for her today. But if you have any program questions specifically, you'll want to email her at this address here or call. And if you have any iSupplier or e-procurement questions, I'm available at this email, and you can also contact the hotline Monday through Friday, 9 to 5, if you have any questions. But other than that, thank you everyone for joining today's webinar. I hope you have a great rest of your Monday and the rest of your week. And again, please feel free to reach out if you have any additional questions about this RFP. Thank you.
Thank you, Tavia. Thank you, everyone.
Thank you. Goodbye, everyone.
Good luck.
Good luck. And again, this court recording will be available for anyone who wants to reference any information. Bye, everyone.
Bye-bye.
Bye-bye.